Hi everybody, this is a video about parasite testing. Before I jump into the meat and potatoes of the video, if you could take a minute to like, subscribe, follow, share, whatever is appropriate on the platform that you're watching this video on, I'd really appreciate it. Just helps my channel out and just helps to get the word out to more folks. So if you find this information valuable from my videos, please consider doing those things so that other people can benefit from them too. So thanks a lot for doing that if you're able to. So someone asked a question on one of my other videos, like I posted a comment on it about parasite testing. So I'm going to read the question here. So it says, is there any harm in doing a parasite cleanse without testing, especially if a person has traveled through Central America, India, and Thailand for extended periods of time? It's a really good question. I actually just had a chat with a patient about this exact topic moments ago, or well, like several minutes ago anyways. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. Please talk to your personal healthcare provider before making any health choices or treatments or engaging in any treatments or whatnot for yourself. The challenge with parasites is that the testing for parasites is notoriously really inaccurate. I put together a research kind of summary presentation on digestive disorders probably about a year ago now, and one of the topics was stool testing for parasites. And to my understanding from the research literature, even when the best testing is done, the best testing being a combination of both culture testing and PCR testing, and even when multiple samples are submitted for some of the most common parasites that we encounter, the testing at least in North America anyways, the testing sensitivity is around 42%. That means in a room full of 100 people, who all have parasites, if they all did this testing, then only 42 of them would test positive. The other 58 of them would test negative. And so it really leaves a lot to be desired. Now, in terms of the accuracy of this testing, so oftentimes we're kind of in a position where we might run a comprehensive stool test. We're looking for things, and based on the patient's history, even if we don't see parasites on the test result, I'll oftentimes, maybe not oftentimes, but in a number of scenarios, I have recommended that patients do indeed pursue an anti-parasite protocol and just see how they feel. There's a couple of reasons why I feel comfortable doing that with my patients, and we don't do it with everyone, once again, but in well-selected patients. One is that if they have digestive issues, and that's not always the main motivation for doing parasite testing, but it's a very common reason why. If they have digestive issues, the herbs that we use or other treatments that we use to help treat suspected parasites can also treat other things too. They can treat SIBO and LIBO and yeast overgrowth and things like that. So there's kind of a multitasking purpose with those herbs anyways. The other reason I feel comfortable with it is because unlike prescription pharmaceuticals, or rather pharmaceutical antiparasitics, which do carry some risk with them, they're by and large quite safe to my understanding, but some of them can be a little bit hard on the liver and things like that. With the herbal options, in my experience, they're very safe. So if a patient doesn't have a parasite or anything overgrowing that's nefarious in their guts, I haven't seen any ill effects from those. Now granted, start herbal protocol too quickly, too aggressively, or a patient's really sensitive, sure, they might have a die-off reaction, they might have some sensitivities to some of the herbs, but in terms of causing any damage to their intestines, in terms of harming their gut microbiome, in terms of increasing liver enzymes or affecting kidney function, I've never seen any issues with any of those herbs over the course of time, and I've recommended them to hundreds and hundreds of patients over the course of time. So in my practice, I certainly do use an anti-parasitic therapeutic trial from time to time. It's not my go-to first-line approach for patients by and large, but there are certainly cases where it's like, well, it seems like we've treated SIBO, we've treated LIBO, we've treated yeast, we've treated everything that made sense, we've tweaked the diet, and yet there's still persisting digestive issues or sometimes non-digestive issues that we think might be related to parasites. In my opinion, it's something where doing a therapeutic trial is a viable option, whether or not the patient's able to do the official parasite testing, because again, that leaves a lot to be desired. So I hope that this answered your question. If you or anyone else has any follow-up questions about this topic, please post in the comment section below, and I will do my best to answer as soon as I can.